Hello, my name is Dr. Dave Webster, and this is part of my ongoing video blog series about the travesty of lack of access to PET-CT in Ontario. This is video number 2 in a series of videos I will be releasing about the roles of Cancer Care Ontario and our oncologists in Ontario's healthcare system. This particular video is entitled My Challenge to the Senior Cancer Care Ontario Committee Members Dealing with PET-CT in Ontario. Now, I am a nuclear medicine physician, one of Canada's PET experts, and so I will be speaking almost exclusively about PET. But what is very critical for those watching this video, with the exception, of course, of the government officials, is that PET is simply the best and most egregious example of how healthcare policies in general are formulated in Ontario and have been for a very long time. And these are policies that affect you, your family members, and your loved ones. And so this video is part of a series where I will be approaching or putting forth the most critical question I believe I've asked to date, and that is, where do Ontario's oncologists' loyalties lie? Is it with their patients, as you would hope, or is it with Cancer Care Ontario? Now, important to understand that Ontario's oncologists are the only physicians in Ontario who are paid by Cancer Care Ontario. The rest of us are paid by the Ministry of Health. Now, I'm going to make what people will see, I'm sure, is my most aggressive and outrageous public statement to date on this, but I have a very strong conviction about this statement, and it is based on a lot of years of dealing with these people and the facts that are available, but also almost 20 years of the efforts of my colleagues and I to try and get the Ontario politicians and their experts to defend how they have assessed PET. And that statement is this: there is a malignancy infiltrating Ontario's healthcare system, and that malignancy is called Cancer Care Ontario, and these are some of the victims. Now, if you think this is a slanderous and unfounded statement, then I would simply ask that you hold your opinion until you've seen the series of videos on their roles of Cancer Care Ontario and the oncologists in our healthcare system, so that you are more informed. Now, all of the backing information will be on my website and my social media sites, but this particular video is directed to you, Dr. Michael Scherer. Now, Dr. Michael Scherer is the president and CEO of Cancer Care Ontario, and some of his colleagues are Dr. Robin McLeod, CCO Vice President of, get this, Clinical Programs and Quality Initiatives. Dr. Julian Dobranowski is a radiologist and Provincial Head of Cancer Imaging Programs for Cancer Care Ontario. This is Dr. Mark Levine, who's the Director of the Ontario Clinical Oncology Program, and Dr. Metzer, who is the current Chair of the PET Steering Committee. Now, you are all so very proud of having achieved the extraordinary feat of taking Ontario's patients to very last place amongst advanced medical jurisdictions offering PET on the planet. Now, if you find this video also upsetting, then might I suggest this: instead of just taking screen caps of my statements on social media, why don't you try this for a change? Why don't you try publicly standing up and defending your actions, and of course demanding that you finally get the respect that you must assume you deserve for your remarkable accomplishments on behalf of your political masters. Now, as you're all aware to date, you have refused to answer or respond to questions that I've submitted to you regarding some profoundly serious statements and accusations by major Canadian and international medical experts, as well as a professional medical association. Now, your response to my refusing to accept your silence on these matters has not been to supply the documents and facts and science-based evidence to back your claims, but of course it is to threaten my license to practice medicine. If I continue to give this information to physicians and patients, as you can see I continue to do, you are threatening to take away my license to practice medicine. Now, this alone makes it clear, beyond a shadow of a doubt, that you all have something very, very serious and disturbing to hide from the public. And of course, you all know what I'm talking about. But you also know that there were criminal charges laid against Australian officials and experts who made attempts to block PET in Australia a number of years ago. But in addition, you're now actually refusing to answer the questions of cancer patients in Ontario. Now, in theory, these people are supposed to have all of their concerns and questions addressed about their investigations and therapy because they live in Ontario. But these questions have been submitted to Cancer Care Ontario officials and, of course, to Dr. Robin McLeod, who is, remember, head of the clinical programs and quality initiatives. In fact, as you know, what led to you people calling the senior administration at the hospital I was working at and told them to threaten to shut me down is because I kept on insisting that somebody from Cancer Care Ontario should be addressing these patients' concerns, and surely there'd be no better people to do that than the ones who were making the decisions, quite literally affecting their lives. But as you also know, one of the patients in particular, a key patient, died an absolutely horrible death, and her death was 100% because her physicians were forced to follow Cancer Care Ontario, quotes, standards of practice, end of quotes, that are, of course, based in the mid-1990s. And for those who may not have seen that video, you might want to go to my YouTube channel and watch the CCO mandated version, or Assault on Carol, the short version. I hope you find that very disturbing and motivates you to finally bring this to the public's attention, in spite of the journalist's efforts to block it. But of course, you did not answer this patient's questions before she died, and of course, now that she's died, her family members have continued to try and get answers to these questions, which you've also ignored. So why are you ignoring these questions, Dr. Scherer? On the other hand, of course, you have these public statements of CCO's guiding principles, and that's like transparency, equity, evidence-based medicine, and blah, blah, blah. But let's look at evidence-based medicine. Everyone agrees, of course, that there's absolutely no scientific evidence or basis to support how you have been evaluating PET in Ontario. And what about open transparency and accountability? Insist that you explain how you have evaluated PET. And of course, what you're doing is threatening me. There's a terrible disconnect between these public statements and what the reality of it means to have cancer in Ontario, or for that matter, other serious concerns and questions such as, do I have dementia? These statements are nothing more than pure propaganda statements, and that's to be polite. Now, I've made public statements that have upset you, and one of them is this, and I say it again. If you get cancer, you should leave Ontario immediately. But of course, as you know, I'm not the first one to say that. Way back in 2006, a prominent Canadian Cancer Advocacy Coalition said this: if you do not want access to modern investigations of your cancer, i.e. PET scanning, or current treatments, move to Ontario. Now, what about your oncologists, your employees? And I'm going to have a lot more to say about this in my subsequent videos, but in a rather disturbing turn of events, my local oncologists are now also threatening me. Why? Because I dared ask them to justify their imaging management of one of my own lung cancer patients. Now, does this sound familiar? But on the other hand, you continue to claim that you are a world-class cancer care agency. Now, but as you know, since 2005, major Canadian and international experts have openly condemned what you're doing, and they've claimed that what you're doing is unethical and even bordering on immoral. Now, this must be far more annoying than having someone like me, a mere nuclear medicine physician and PET expert in Northern Ontario, pestering about your noble efforts, which you are also very proud of. Surely you must want to show the world that, okay, fine, we've taken Ontario's patients to the last place amongst advanced medical jurisdictions, but you had your reasons, and surely they are honorable reasons. The actions of Cancer Care Ontario against Ontario cancer patients is anything but honorable. And I would predict this, that history will rightly record that what CCO has been doing to patients will be seen as one of the most abominable and shameful episodes in the history of public medicine in Canada. So I will make another public statement, and that is this: the role of Cancer Care Ontario is to be mouthpieces for Ontario's politicians and their health care agendas. Now, nobody has challenged this statement, and I keep repeating this one because of the profound importance of this, but Professor Rodney Hicks is a world expert in PET, and he said, I quote, "Ontario has the most egregious and politically motivated agenda against PET," and of course read our patients, "in the world. Those agendas of our politicians are directed against some of Ontario's sickest and most distressed patients." Now, surely the best way to make this all go away and finally show all these naysayers that Cancer Care Ontario truly is a world-class agency will be to do simply this. Let's go back to those Canadian Association of Nuclear Medicines made way back in 2005, which in part said these experiments cannot be regarded as ethical, but most importantly, wanted to have an external review of what you've been doing in Ontario by Canadian experts in ethics and health policy. So, what will it be? Are you going to continue to force Ontario physicians to quite literally assault our patients on Cancer Care Ontario's behalf and threaten me like what was done to Carol? Or are you going to demand the ethics review takes place and finally take credit, or dare I say responsibility, for your actions against Ontario's patients? And remember, this isn't just about PET. And so my next video is going to be entitled A Brief Time Frame Outlining the Actions of CCO over the years. And so thanks for watching. I've added this at the end because for some reason the camera stopped recording in the last few seconds, and hopefully you will make allowances for my amateurish efforts to try and get this information out to you. Take care.